What nonverbal cues are missed in online therapy sessions? Imagine trying to catch every little feeling someone has just by listening to their words. That's what therapists do during in-person visits, but online, many of those clues can slip away. When you are in a room with your therapist, they notice how you sit, whether you lean forward or cross your arms. These small movements tell a lot about how comfortable or anxious you might be. But on a video call, only your head and shoulders are usually visible, making it hard to see your full body language. Gestures are another important part of communication. Tiny hand movements or fidgeting, like tapping your fingers or bouncing your leg, can show nervousness or impatience. These gestures are often outside the camera's view or too subtle to notice. Microexpressions, which are quick facial movements that reveal true feelings, can also be missed. Even with a good camera, lighting and resolution can hide these fleeting expressions. Eye contact is a big part of feeling connected during therapy. When in person, looking into someone's eyes can show empathy and engagement. But on a screen, it's tricky. Looking at the person on the screen isn't the same as looking into the camera, so it can seem like you're not paying attention or not interested. This can make the therapist feel less connected to your emotions. The physical distance between you and your therapist also matters. In a real office, how close or far apart you sit can tell the therapist how comfortable you are opening up. Online, this spatial cue is lost because you're in your own space, and the camera only captures part of your environment. Tone of voice and breathing are other clues that can be harder to pick up. Poor audio quality or background noise can hide subtle changes in how you speak or breathe. These changes might signal stress or emotional distress, but they can be missed if the sound isn't clear. Your home environment can give some hints about your mood, but it's not the same as a neutral office setting. Distractions or clutter in your background can divert attention away from your feelings. Without the controlled environment of a therapist's office, it's harder to focus solely on your emotional state. All these missing or less visible cues mean therapists have to work harder to understand what you're really feeling. They often ask more direct questions or encourage you to describe your feelings out loud. Some therapists even exaggerate their facial expressions or check in more often to make sure they're understanding you correctly. Choosing video therapy over just phone calls or text messages helps keep some of these nonverbal cues alive. It's better for communication, but it's not perfect. To get the most out of online therapy, setting up your space with good lighting, positioning your camera to show more than just your face, and ensuring clear audio can make a big difference. Even with these challenges, online therapy offers many benefits like convenience and safety. Some therapists suggest mixing in-person and virtual sessions to get the best of both worlds. That way, you can enjoy the comfort of your home while still capturing more of those important nonverbal signals during key moments. Remember, understanding what's not seen or heard is part of making online therapy work well for everyone.